Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning,
everybody.
We are back together.
Yeah,
Woo-hoo!
we are back
Live.
together,
Live.
everybody.
It's
We've
been like a
waiting
year.
for you.
It's been like a year
Feels like it,
away
yeah.
from my microphone.
Yes.
And my Anita and my Richard.
Yes, and
My
your patience.
Richard was so nice. You know, Richard went by, he sent me a text after the hurricane. And he got, Doctor, I just checked on the two property on Commercial Boulevard, everything. It looks okay from the outside. The basic need of a human being. This is what this post-hurricane and the earthquake and all this thing going on and thing probably still to come to us. The take-home message of today's talk among us three is keep track of your basic needs. Your cell phone is not a basic need. Your color television is not a basic need. Your airplane is not a basic need. Your basic needs is food, shelter, water.
Perfect.
Food, shelter, and water, ladies and gentlemen. So those of us
and people, other human beings.
And then people needing people. Right. So, once you have food, shelter, and water, if you look at everything else that we have, what it does, it separates people from people. It isolates us. And a lot of the things we have. You have a house with a big gate and a big television and everything you need inside the house. You don't need to go to your neighbor for anything. You might not even know who's your next door neighbor is. Because, so all of these things that we have outside our basic needs are isolating us from being, human beings. And, I felt so bad for my patient. I suffered a lot because of my patient, because I couldn't have a generator to go and open that office. And I look at the structure. The structure was a few damages on the roof and here and there, but stuff that we can still function with, You can see the low ceiling that, water came down, but it wasn't like falling apart. So we can still function, but we didn't have electricity. So we had to stay shut.
What did your patients do?
They called. The phone was down, so people were trying to call, so it was kind of difficult. Then got to Facebook. Some of the patients that are on Facebook, they text AGI on Facebook, and we would text them back, and they wanted to know when they're going to open, when can I come in, if they needed a medication, we would text them back and say, we'll call the pharmacy, give me the phone number, give me your date of birth, because we didn't have a generator, we couldn't turn on the computer. So the computer was out. So, and all of that is out of basic needs, outside the scope of our basic needs. So it shows how our developed country need to always cherish people working with people. We cannot move apart from that. We need to remember, I'm so amazed to see the people of Puerto Rico with everything going on. They are working with each other, helping each other. I saw the people that work for one of the town there trying to pick up the garbage with the truck. And then the community people grabbing the garbage and helping the guy throw the stuff away.
Yes.
So I say, wow, look at all of these people working together, to pick up the garbage.
In Houston, they said that there's so much garbage, it would fill 28 football fields. I mean, how long and where are they going to find enough people and places to move it?
To move all of that. It's devastating and it's stressful. So, and I'm seeing since we opened the office, we had been so busy. People coming in from very early once we opened to late in the afternoon. They don't want us to close. They want to be seen. And we have seen some of our patients decompensate, patients with bipolar disorder decompensating. And it's horrible because I have to, from time to time, stop everything and then sit down and talk to my staff because some of them just want to quit. We have one of my patients with schizophrenia, and she was calling like every 2 minutes and hanging up, calling and hanging up. And I went and I picked up the phone and I said, listen, we are here to help you. We want to work with you. If you cannot see your psychiatrist, remember, I'm a psychologist. Come to me. I will help you. And she would still go, hang up and call again.
So she can't help herself.
And my staff wanted to quit. And I have a young lady that was being interviewed yesterday for the front desk. So as this young lady was being interviewed, she said, like, what the heck is going on?
Right,
This is a crazy office. Yeah. And I told her it is right now. It is a crazy office. Mm-hmm. This is not our norm. But, this is post-hurricane trauma. We're all dealing with this post-hurricane stress. We're all dealing with this. We have to go through this. And then you have the Puerto Rican that live in the island. You have the Puerto Rican that live in the mainland. So
wait. There's an island. Well, it is an island.
The island, the Puerto Rican that live there in the island, then the Puerto Rican that live here in the mainland.
Oh, I'm sorry. Okay,
yeah, in Hawaii we call the big, the state we call the mainland. We call in Hawaii.
Okay, because you're right. They're frantic. They don't know what's happening.
They don't know what's going on with the family, the disconnection. People don't know how to help, and that's another thing. A lot of times, if you think about it, I was listening to a program for, I think it was one of the ladies from one of the organizations that helped after a disaster, a natural disaster. And she was saying that a lot of times through this natural disaster, so much gifts are wasted. People give clothes and television. If you have a refrigerator, if you have no electricity, why do you need a refrigerator?
Right. And they're sending
what are you going to do with
it? People sending clothing, suits.
And the toys.
Toys. They have mountains of toys.
Yeah, you're absolutely right. I heard
and then people
story.
sending stuffed animal. What are you going to do with the stuffed animal?
They need quilts. They need sheets.
They need money. You know what they need? They need money. Because with the money, imagine they can buy what they want, and they can really buy, and it's a lot cheaper. It's a lot cheaper to buy.
Faster, they can send it right now, right?
To buy, let's say, gasoline for a generator to keep the shelter going.
They need sanitary pads, diapers for children.
Money. Just money. People need just money.
But how will they get them? Are the stores there?
Then with that money, the people that are serious and honest about distributing the finance, they are there and they will know what to spend the money in. The recovery will be so much faster. If there's somebody gives Florida money right now, what do we need the money for? To clean the streets, right? To make sure there's gas in all the stations, to make sure there's food back in all the shelters. Each community will know how to distribute the money. People don't need to be having, we can always use water and this and that is basic need. Water and food, canned stuff. But in reality, if you give money will help the country build much faster.
Okay, but you can't send the money to your loved ones because we don't know where they are.
Well, but you can send it to an organization, and you don't do it for your loved one. You do it for human being.
For the organizations, you just go.
The organization that that were, there are organizations out there that take 75% of donation for quote unquote administrative use. So you are not really donating to the people. You have to do your research. And I cannot speak one against the other, because if I knew the truth, I would say it right here and now. But we all have to do our research to make sure that the organization is doing what they're supposed to be doing. But trust me, ladies and gentlemen, if you're going to donate money. And the basic need for people is shelter, food, and water. Those are basic needs.
Right? That's at the
Those
very
are
beginning.
basic needs. If once we meet the basic need, then we can rebuild much faster, much faster.
Wow. Okay. So now, can you imagine what about the hospitals? Are there any hospitals even standing in Puerto Rico, do you think? I mean, what are people doing?
Yeah, it's horrible. There was a orphanage that sent an SOS a couple of days ago. And they had to go by trucks because there's so much water. You know, those trucks they have that can pick up the garbage.
Yes.
So with the portion that they pick up the garbage, the helper sat on inside there.
Oh my gosh.
And the truck was able to drive and get to the orphanage. It is horrible. It is really bad. I've been contacting some of my students that are in Mexico to make sure they are okay. I have contacted some of my colleagues that have family back in Puerto Rico to make sure things are okay. And if you have friends from these countries or, in Florida or in Texas that is going through this thing, just give them a call and say, how can I help you? What can I do?
That's such good advice, and I love it coming from you. And I know you enough to know if you didn't have this big practice and so many responsibilities here, you'd be flying down to Puerto Rico to help.
Absolutely.
Him. That's
Absolutely.
what you would do.
Absolutely.
I know.
Absolutely.
I know. So it must be very hard for you because you're suffering. I can see that in your eyes. You don't know what you can do, and you have to help your people here. That's
right. That's what I'm doing. And I was talking to one of my colleagues yesterday, and of course she called me crazy, but we were talking, and I say, I think I need to open 7 days a week, at least dental, because the 6th day was medical. Remember, Ina?
Yes.
6th day was medical. The 7th day probably is going to be a dental, because so many people with needs, and I have one of my patients that came with a bridge, and he's been coming to us now for a few months, and we always talk on the radio that we do dental and medical.
Yes.
And as he talking, when the medical assistant turned around, he pulled out his bridge, and he said, do you know where I can get this fixed? And put it back in.
Oh, my God.
And put it back in.
Oh, right.
And I told her, we can do this here. Let's go upstairs. And I talked to the manager. Just a little cement, and we can do that for you. And she said, it happened after the hurricane, and she's, where do I go with this thing?
And I'm sure there's so many people, but you're finding that you don't have enough time in 6 days.
We don't have enough time in 6 days. We are really super busy. People are calling. We started now doing twice a month in the Boynton office.
Tell me when, because I had a call. A friend of mine said, I heard you. It's funny. They want you to know when, because they wanted to make an appointment. When will you be in the Boynton Beach office? Do you have that scheduled
It's going to
yet?
be the first Wednesday.
The first and the third Wednesday.
The first and the third Wednesday, because she wants
of
to
every
make
month.
So would it be this month coming up?
We already, I was there last week. I was there last week, so yeah.
Oh, okay, so the first is coming up so she can make an appointment.
For the first, yes.
Okay, she's going to do it. She says, I definitely have to now.
I had one of my, I have a few patients from Homeland Security, but one of my particular patients from there, they live in Boynton. Come here, they come in for Lauderdale.
Down, of course. We all follow you.
And they have a dental emergency, so they went to the Boynton office and said, oh my God, we didn't know Dr. Mencia come here.
Fabulous.
And they're like across the street, so they're going to start
so
going.
First Wednesday and the third Wednesday, people can make an appointment at Boynton Beach. And so I'm going to give that phone number because people don't really know, how to make the two. You can always call the main number and they'll get you there. But let me do that right now. For those of you who want to make an appointment in Boynton Beach, because I think my friend's listening, so you can just do it and not call me back. The phone number for Boynton Beach is 561-272-8255. 270-6494. That's 270-6494. It's going to be the first Wednesday and the third Wednesday of every month. Make an appointment now with Dr. Mencia because they're going to line up to do this, I know. And then I don't want to forget, though, this is the number in Fort Lauderdale. It's 954-489-1345, and they are located actually on Commercial Boulevard. The one in Boynton Beach is located in Hagen Ranch Road. It's very easy to find, but just call them. Also, I was wondering about your home visit services during this time. Did you still do them?
Yes, yes. I have to tell you, one of my geriatrician, you heard about that nursing home. That I think it's
oh
up.
My God!
The death toll is up to 11 now. 11 people so far have died.
They pulled their license and everything now.
Everything. There's
Can't
a big
believe
mess.
That.
There's a big mess there, and I have one of my geriatricians that is like my son, because I took him right off from training, and his mother and his father came to me and he said, Dr. Mencia, that's like your son. Keep him. That's your son. Take care of him. And I've been his mentor all along. And during the hurricane, he went to San Andrew, South and North.
Yes, in Boca Raton.
And Edgewater. To the community, the Axe community, yes. I think it's called the corporation.
Yes.
And he spent the time with them there.
The hurricane.
The hurricane.
So
he spent all the time there.
The whole time.
They had the doctor the whole time.
Fabulous.
He was seeing patients. The clinic was open for the patient that needed to be seen for any emergency, any problem. If you thought you had a call or anything like that, you would go and see Dr. Pham.
Let's have his name. Let's give him a little bit of publicity. What's his name?
Dr. Dean Pham.
Thank you, Dr. Pham, for doing that.
It's the love of being a geriatrician. You can tell this guy didn't become a geriatrician. It's hard to become a geriatrician because you're going to make money. You become a geriatrician because you love taking care of the elderly. And the baby boomer and doing preventive medicine. And he's a very devoted physician. So, when I see the fruits of my tree.
Right. The fruits of your tree.
We're
all fruit on your tree, Dr. Mencia.
So you feel like you've done something right.
It's a good time to get you on. We have wonderful Ina here. We do feel like a fruit off his tree, don't we?
I like to be the fruit on this tree.
I was going to ask you about when you lived in Russia. What happened in Russia? Did they have earthquakes, or were there any things like this?
No, I was telling Dr. Mencia the other day that the safest place to live on Earth is where I'm coming from. That's my home.
Why is
we
that?
We don't have
Siberia.
It's Siberia. We don't, because we're in the middle of the continent. We don't have tsunamis. We don't have tornadoes. We don't have hurricanes. And the way they...
But a lot of snow.
I was just going to say that, but you have...
I'd rather deal with the snow than with the hurricane. But in the way they...
You live there like the Eskimo there.
That's right. Blizzards. They have blizzards.
Oh, please.
Come on.
You
say something. You have to have something.
By now, yes.
Oh, but now with the global warming...
Yeah.
You guys going to lose the...
No, and
you're going to lose the snow.
Yes. Oh, please.
No, because wait. See the front cover of Boomer Times this last month. You saw the polar bears.
Uh-huh.
Mm-hmm.
The polar bears are now eating dolphins. That wasn't ever what they did before because they don't have the same.
People talk about global warming for longest time already, and the ice in the North Pole keep melting.
Right.
It keeps melting. The amount that they do research, the amount that we have to have, the amount that we have, it's dramatically melting.
The glaciers are dropping off.
Right.
And when they go down into the water, the water's got to come up. Where else is it
Exactly.
going to go,
So
right?
the polar bear, imagine in the forest.
Mm-hmm.
If you burn the forest, what's going to happen to all those animals? They live in the forest. That's their
home. That's
right. So for the polar bear,
it's the same thing.
It's the same thing.
But they're having the fires out. They're having the fires out in California. And my family lives in Portland, Oregon, and they have huge fires. And you think about all the animals there. Where are they going to go when it's burning? So
that's another thing for us with the part of the stress. Most people's houses, when we were doing the home visit, you see the pile of branches and tree in front of their house. And now, if anybody throws cigarettes in there or anything like that, it's gonna burn.
I never thought about that. A lot of people have
it's so
all
much
those
stress.
And
things
it's
out
all
there.
dry by now.
It's all dry. It's
already.
already dry, so it can easily light up.
Catch a fire.
So they
catch
better
a
get
fire.
really a lot of the services better get. I hadn't even thought about that.
Yeah,
Because,
I see. You see these people. Everybody's working. Around the clock.
Yeah.
You see people working around the clock, but still for the receiver, the people living at home and all of that.
It's food,
it's
shelter, and water. I
Yes.
love that. Sissy, I got to do something with that. That's what we'll do for your next column, because I think it's really important.
The basic need, the basic
right.
human needs.
Keep track of your basic needs.
Right.
The human basic needs. It's true. And I know that you stress that, but you see, that's how you run your clinic, actually. I think when people come in there, when I go to the clinic, go to your centers, you see very strange looking people. They're all different.
They're all different.
They're
right.
young, they're old, there's some people in wheelchairs, some people are half naked. I mean, they come from all over to come see you. But you actually just see them as this big heart. I know you. You see them when they walk in, they have a big heart. I don't mean a bad heart, a big heart.
Mm-hmm.
And you just see them. That's who they are. And you just take care of them no matter what they say or what they look like or anything.
Absolutely.
That's
Absolutely.
Who you are.
And, that's what will bring us together. Look at number 48 talking about the president from North Korea.
Oh.
Regardless of how much we dislike what this man is doing, do not belittle another leader. That's such a low blow to start belittling and cursing and saying.
Bullying.
He's such a good bullier. He's one of the best.
I know. It's very bad.
Bulliers.
It's a different world we live in, and you and I and Ina do not like that part of the world. We are
and sometimes I feel sorry for his wife.
Oh.
For his whole family, probably.
No, I don't know. I think the family, I don't know what to say about the family.
Well, they have problems just like everybody else, but when you have a lot of money and you have a lot of power, it should make you better, not different.
Exactly.
But,
and sometimes, people use the money to manipulate other people. Because
Imagine
if I'm
if
his son-in-law and I'm Jewish, and the thing that he's saying against the Jewish people and black and other things, sweetheart, I swear to you, I would be like walking out. Say, I'm out of here.
You
are offending
you
are offending
Right.
my ethnicity. I'm out of here.
Just think about something. What if he took just even 20% of all his money and gave it to all these places that are in such need? What he would feel so happy and so good.
Exactly.
People don't know. When you have that kind of money, I think it's a responsibility to share it and to give it.
Right.
And that's really what makes the difference.
But I mean,
person.
he's the type of person that instead of seeing the opportunity to give, he see the opportunity to make more money.
To take.
Yeah.
The difference in giving and
He
taking.
probably see what can I do now in Florida or Puerto Rico to build something to be majestic.
But the reason is it's funny how human beings are all different, and it must have been your family. See, I always go back to the family. And so sometimes it's not the fault of the person. It's the fault that the family never showed a person what it could be like.
The family up to certain age.
Okay.
And there is an age that we have to take responsibility.
Yes, I agree.
Because my mother and my father, they were great with me, but then I had a time for me to make my own decision. Do I want to be great or do I want to take another direction in my life?
Yes, that's
And
very
I
true.
followed the direction they taught me.
Yep.
But regardless of what the family taught him and what people did, regardless of that, he has so many opportunities to have change.
Yeah.
Now that he has such the biggest responsibility that we
right,
can
Dr.
have,
Mencia.
not only for our country, but internationally. And
well, I wish you, if I could wave a magic wand and make you president, I would. Dr. Mencia for president. We're going to end the show that way. Okay, everybody, write in. He's your write-in candidate. Dr. Mencia for president.
Put your ballot.
Yeah. All right, we'll see you next week. Thank you.
Thank you.
Bye.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.